All right, so the destination is electronic health records and informatics. If you're not planning to go that destination, it's time to leave the room, at least temporarily. And the session outline will be similar to the others in the sense that we're going to revisit in some greater detail specifically to answer questions that came up yesterday in this general area using our topic leads for the white paper. I'm going to do 1 minute on a neologism that derived from yesterday's conversation and actually addresses a specific question that Francis asked about participant engagement and representation. We're then going to have Rex Chisholm talk about motivations to contribute clinical data at the both organizational and individual level, lessons that have been learned actually doing this at scale in NIH-supported consortia. And Josh Denny will be the speaker for that. And then Doug Fritzma is going to talk about our blue button to Sync for Science functionality and his background as formerly the Chief Science Officer of ONC positions him very well to talk about what's needed to go from where we are now to what we need. And then we'll, as with the other sessions, we'll have a Q&A. So, oops. I have to, do I click? All right. So the idea that I heard actually yesterday, first from Jim Ostell and amplified by Sharon Terry, and I think it's an answer to Francis' question, was the idea that this cohort could distinguish itself by something I would call precision participant engagement. And I actually Googled that to make sure that somebody hadn't already created that, and guess what? The first 4 links came to the NIH page for this conference, so I think we're in, right? But it's based on the principle that individuals, however expert, who serve as a surrogate for a group's opinions and preferences, at best, can only be approximately correct, right? So Francis asked yesterday, well, if we have representatives for disease advocacy or whatever it is, how do we know we have the right group of representatives? So at best, any person trying to aggregate and sum and represent other people is only going to be approximately correct. So to be precisely correct, you have to ask each individual in the group, right? So this concept of operations that might be adopted, and I'm indebted to Dixie Baker for the term concept of operations as a computer scientist, would be that in doing its work, this cohort would use experts for a first approximation of what was to be done and how to do it, but then would use an informatics infrastructure of communication using social media, polls, surveys, to do 2 things. One is to vote in situations where you could do it several different ways, but you can only do one, and you want to do it one way across that. So then that becomes kind of true democracy voting. And then, as we heard in Sharon Terry's description of her PPRN experiment, if you have multiple ways you can do something, then you would record and use those individual preferences for how it's done with respect to that individual participant, such as their permission set for use of different classes of data. Okay, that's my 90 seconds on precision participant engagement. So let me ask Rex Chisholm to come up and address the topic of organizational and individual motivations for becoming part of this project, and specifically for offering clinical data as part